Reproductive system. Reproduction is important for survival of all living things. Without a mechanism for reproduction, life comes to an end. Reproduction guarantees the transmission of one generation genetic material into the next generation. Without this transmission, the species will cease to exist after all of the members of the current generation have died out. Thus, reproduction is essential to continue survival of a species over time. Human reproductive system. Humans are most advanced mammals and correspondingly show a reproductive pattern, which is most efficient, especially in the sense of protection of the embryo within the female body as well as its care after birth. The male and female reproductive system in human as is follows. Male reproductive system. Male reproductive system consists of pair of testes, ducts, glands, and external genitalia. Testes. Testes are male gonads which are situated outside the abdomen within skin pouch called scrotum. Each testis is divided into 250 to 300 lobules. Each lobule contains 1 to 4 tightly curled seminiferous tubules. The process of spermatogenesis takes place here in the seminiferous tubules. Leydig cells are present between the seminiferous tubules which produce male sex hormone testosterone. The accessory ducts include the vasa efferentia, the epididymis, the ductus deferens, ejaculatory duct, and the urethra. Vasa efferentia. About 10 to 20 vasa efferentia collect sperm from inside the testes and transfer them to the epididymis. The epididymis rests on the backside of each testis. Most of the epididymis consist of highly coiled ducts up the epididymis with an uncoiled length of about 6 meters 20 feet. Its function are transport and storage of the sperm. Here the sperms are stored temporarily, nourished, and they gain the ability to swim. What's difference? It starts from the epididymis, moves deep into the pelvic cavity, and then joins with the duct of seminal vesicles to form the short ejaculatory duct. Each ejaculatory duct enters to prostate, there it empties into the urethra. Urethra. The urethra is the terminal portion of the male duct system. It opens to the outside at the external urethra orifice and conveys both urine and semen. Accessory glands. The seminal vesicle provide an alkaline fluid containing fructose, sugar, ascorbic acid, and coagulating enzyme called vesiculase, as well as other substances that enhance sperm motility, thus improve their fertilizing power. The prostate encircles the urethra just below the bladder. Its secretion is milky, slightly acidic fluid that contains citrate as a nutrient source and several enzymes, especially hyaluronidase. Coffer glands secrete mucus and an alkaline fluid into the urethra. The alkaline fluid neutralizes the acidity of urine in the urethra. The bulbourethral glands produce thick and clear mucus. Semen is white, sticky mixture of sperm and secretion of accessory glands. The liquid substance in the semen provides nutrients and protection to sperms and acts as transport medium for sperms. Prostagland, prostaglandins and semen decrease the viscosity of mucus guarding the entry of cervix of the uterus and stimulate reverse peristalsis in the uterus, facilitating sperm movement through the female reproductive tract. Spermatogenesis. It is the process of sperm formation in males, which involves a precise sequence of events. This process takes place in seminiferous tubules. Spermatogonia are the outermost cells which make the epithelial wall of the seminiferous tubules. These cells are just beneath the basal lamina. The spermatogonia divide continuously by mitosis, and each mitotic division of spermatogonium results in two distinctive daughter cells type A and B. The type A data cell remains at the basement membrane to maintain the germ cell line. The type B cell gets pushed toward the lumen where it becomes a primary spermatocyte destined to produce spore sperms. Each primary spermatocyte undergoes meiosis I, forming two smaller haploid cells called secondary spermatocytes. The secondary spermatocytes continue on rapidly into meiosis II, and their daughter cells called spermatids are formed. Each spermatid as a round, non-motile haploid cell. Spermatogenesis is a process in which spermatids change into motile and active sperms. During this process, a spermatid elongates, sheds its excess cytoplasm, and forms a tail. Sperm. The sperm or spermatozoon animal seed is very small haploid cell. It has a head, a neck, midpiece, and tail. The head contains the nucleus having a flat seed of chromosomes. Adhering to the top of the head is a chromosome. The lysosome, like a chromosome, is produced by the Golgi apparatus and contains hydrolytic enzyme hyaluronidase that enable the sperm to penetrate and enter an egg. The neck of sperm is very short and contains a pair of centrioles, the microtubules of one of the centriole elongate and run the entire length of tail. It forms the axial filament, the tail. The middle phase contains many mitochondria arranged spirally around the axial filament. The process begins around the age of 14 years in males and continues throughout life. Every day, a healthy adult male makes about 400 million sperms. Hormonal control. Process of spermatogenesis is controlled by hormonal secretions from hypothalamus and pituitary glands. The hypothalamus releases gonadotropin releasing hormone which control the release of anterior pituitary gonadotropins, follicle stimulating hormone FSH, and luteinizing hormone LH. FSH stimulates spermatogenesis by stimulating the Sertoli cells synapses that is part of seminiferous tubules. To complete the development of sperms from spermatids, luteinizing hormone stimulates Leydig cells found adjacent to seminiferous tubules in the testicles to release testosterone. Testosterone causes the growth and development of germinal epithelium to form sperms. Inhibin hormone is produced by the Sertoli cells and serves to control the spermatogenesis at normal rate. When the sperm count is high, inhibin release increases and it inhibits anterior pituitary release of follicle stimulating hormone. Hypothalamic release of gonadotropic hormone. When sperm count falls, inhibin secretion declines swiftly. Female reproductive system. The reproductive role of the female is far more complex than that of male. Not only must she produce gametes, but her body must prepare to nurture a developing embryo for a period of approximately 9 months 10 days. Female reproductive system consists of pair of ovaries, oviduct, uterus, cervix, and vagina. Ovaries. Ovaries are female gonads which produce ova and release hormones. The paired ovaries flank the uterus on each side, and each ovary is held in place with the peritoneal cavity by several ligaments. The ovaries are almond-shaped, measure about 3 to 5 centimeter long and 2 to 3 centimeter wide. Within the ovary are many tiny sac-like structures called ovarian follicles. Form the initial part of female duct system. They receive the ovulated oocyte or the site where fertilization generally occurs. Each oviduct is about 10 centimeters long and extend near from the region of an ovary to empty into the uterus. The uterine tube contains sheets of smooth muscles and contains both ciliated and non-ciliated cells. The oocyte is carried toward the uterus by a combination of muscular peristalsis and beating of the cilia. Non-ciliated cells produce a secretion that keeps the oocyte and sperm present, moist and nourished. Uterus. The uterus is located in the pelvis, anterior to the rectum and posterior to the bladder. It is about the size and shape of an inverted pear. Uterus. The uterus is located in the pelvis, anterior to the rectum and posterior to the bladder. It is about the size and shape of an inverted pear. It is hollow, thick-walled muscular organ that functions to receive, retain, and nourish a fertilized ovum. The wall of the uterus is composed of three layers. The perimetrium is the outermost thin covering layer of the uterus. The myometrium is the middle thick muscular layer composed of bundles of smooth muscles that contracts rhythmically during childbirth to expel the baby from the mother body. The endometrium is the inner spongy lining of the uterine cavity. If fertilization occurs, the young embryo takes root into the endometrium, implants, and resides there for the rest of its development. Cervix. It is a narrow entrance to the uterus from the vagina. It is normally blocked by a plug of mucus. Vagina. The vagina is thin-walled, 8 to 10 centimeter long tube and extends from the cervix to the body exterior. It is often called the birth canal as it provides a passageway for delivery of an infant and for menstrual flow. The urethra is embedded in its anterior wall. Oogenesis. The process of egg formation in female is called oogenesis. The process of oogenesis takes years to complete. First, in the fetal period, the oogonia, the diploid stem cells of the ovaries multiply rapidly by mitosis and then enters a growth phase and lay a nutrient resource. Gradually, the oogonia are transformed into primary oocyte and become surrounded by a single layer of follicle cells. The primary oocyte begin the first matrix division but become stalled late in prophase 1 and do not complete it. They remain in their state of suspended animation all through childhood. The wait is long 10 to 14 years at the very least. At puberty, a small number of primary oocytes are recruited each month. However, only one is selected each time to continue meiosis 1, ultimately producing two haploid cells that are quite dissimilar in size. The larger cells, which contain nearly all the cytoplasm of the primary oocyte, it is secondary oocyte. The smaller cell is called the first polar body. In humans, the secondary oocyte arrests in metaphase 2 and and it is this cell that is ovulated. If an ovulated secondary oocyte is not penetrated by a sperm, it simply deteriorates. But if sperm penetration does occur, it quickly completes meiosis 2, yielding one large ovum and tiny second polar body. The unequal cytoplasmic division that occur during oogenesis ensure that fertilized egg has ample nutrients for its 6 to 7 day journey to the uterus. Without nutrient containing cytoplasm, the polar bodies degenerate and die. Menstrual cycle. The reproductive cycle in humans and other primates is called menstrual cycle. The first menstruation begins at puberty. Uterine or menstrual cycle a series of cyclic changes that uterine endometrium goes through each month as it responds to the waxing and waning of ovarian hormones in the blood. These endometrial changes are coordinated with the phases of the ovarian cycle, which are controlled by gonadotropins released by the anterior pituitary. Various phases of menstrual cycles are as follows. Menstrual phase 1 to 5 days. In this menstruation phase, the uterus sheds all but the deepest part of its endometrium. The thick hormone dependent functional layer of the endometrium detaches from the uterine wall, a process that is accompanied by bleeding for 3 to 5 days. The detached tissue and blood pass out through the vagina as the menstrual flow. At the beginning of this stage, ovarian hormones are at their lowest normal level and gonadotropins are beginning to rise. Then, follicle stimulating levels begin to rise. Proliferative pro-ovulatory phase 6 to 14 days. Under the influence of rising blood level of estrogens, the basal layer of the endometrium generates a new functional layer. Consequently, the endometrium once again becomes velvety, thick, and well vascularized. Normally, cervical mucus is thick and sticky, but rising estrogen level cause it to thin and become crystalline, forming channels that facilitate the passage of sperm into the uterus. Ovulation, which takes less than 5 minutes, occurs in the ovary at the end of the proliferative stage in response to the sudden release of luteinizing hormone from anterior pituitary. Luteinizing hormone also converts the ruptured follicle to a corpus luteum. Secretory post-ovulatory phase, days 15 to 28. This 14-day phase is the most important during the secretory phase. Endometrium prepares for implantation of an embryo. Rising level of progesterone from the corpus luteum act on the estrogen-primed endometrium, causing the arteries to elaborate and converting the functional layer to the glandular secretory layer. The uterine glands enlarge chyle and begin secreting nutritious glycogen into the uterine cavity. These nutrients sustain the embryo until it is implanted in the blood-rich endometrial lining. If fertilization has not occurred, the corpus luteum begins to degenerate toward the end of secretory phase as luteinizing hormone blood levels decline. Progesterone level fall, depriving the endometrium of hormonal support, and endometrial cells die, setting the stage of menstruation to begin on day 28. In female, menstrual cycle ceases around 50 years of age, and it is termed as menopause. Cyclic menstruation is an indicator of normal reproductive life of females. Disorders of reproductive system. Female infertility. Infertility means not being able to get pregnant. Women who can get pregnant but are unable to stay pregnancy may also be infertile. Pregnancy is the result of a process that has many steps to get pregnant. A woman's body must release an egg from one of her ovaries ovulation. The egg must go through a fallopian tube toward the uterus. A male sperm must join with fertilize the egg along the way. The fertilized egg must attach to the inside of the uterus implantation. Infertility can happen if there are problems with any of these steps. Most cases of female infertility are caused by a problem with ovulation. Without ovulation, there are no eggs to be fertilized. Some signs that a woman is not ovulating normally include irregular or absent menstrual periods. Less common causes of fertility problem in women include blocked fallopian tubes due to pelvic inflammatory diseases, endometriosis, physical problems with the uterus, uterine fibroids, which are non-cancerous clumps of tissues and muscles on the walls of the uterus, male infertility. Infertility in men is most often caused by a problem called varicocele. This happens when the veins on men's testes are too large. This heats the testicles. The heat can affect the number of shape of the sperm. Other factors that cause a man to make too few sperm are none at all. Movement of the sperm as yet another cause of infertility. This may be caused by the shape of the sperm. Sometimes injuries or other damage to the reproductive system block the sperm. Sometimes a man is born with the problem that affect his sperm. Other times problems start later in life due to illness or injury. For example, cystic fibrosis often causes infertility in men. In vitro fertilization. In vitro fertilization means fertilization outside of the body. In vitro fertilization is the most effective type of assisted reproductive technology. It is often used when a woman's fallopian tube are blocked or when a man produces too few sperm. Doctor treat the woman with hormones that cause the ovaries to produce multiple eggs. Once mature, the eggs are removed from the woman. They are put in a dish in the lab along with the men's sperm for fertilization. After 3 to 5 days, healthy embryos are implanted in the woman's uterus. Miscarriage. A miscarriage is the spontaneous loss of a fetus before the 20th week of pregnancy. Pregnancy losses after the 20th week are called preterm deliveries. A miscarriage may also be called spontaneous abortion. This refers to naturally occurring events, not medical abortion. Most miscarriages are caused by chromosome problems that make it impossible for the baby to develop. Usually, these problems are unrelated to the mother or father genes. Other possible causes for miscarriage include drug and alcohol abuse, exposure to environmental toxins, hormones problems, infections, obesity, physical problems with the mother reproductive organs, problems with the body immune response, serious body-wide diseases in the mother such as uncontrolled diabetes and smoking. It is estimated that up to half of all fertilized eggs die and are lost aborted spontaneously, usually before the woman knows she is pregnant. Among those women who know they are pregnant, the miscarriage rate is about 15 to 20%. Most miscarriages occur during the first 7 weeks of pregnancy. Abortion is defined as the termination of pregnancy by the removal or expulsion of a fetus or embryo from the uterus before it is viable. An abortion can occur spontaneously, in which case it is usually called a miscarriage, or it can be purposely induced. The term abortion most commonly refers to the induced abortion of human pregnancy, sexually transmitted diseases. Gonorrhea. The causative agent of gonorrhea, gonorrhea, is Neisseria gonorrhoeae, which invades the mucosae of the reproductive and urinary tracts. The most common symptoms of gonorrhea as males is urethritis accompanied by painful urination and discharge of pus from the penis. Symptoms vary in women, ranging from none about 20% of cases to abdominal discomfort, vaginal discharge, abnormal uterine bleeding, and occasionally urethral symptoms similar to those seen in males. Untreated gonorrhea can cause urethral constriction and inflammation of the entire male duct system. In women, it causes pelvic inflammatory disease and sterility. It can be treated by penicillin, tetracycline, and certain other antibiotics. Syphilis. Syphilis is caused by Treponema pallidum and is usually transmitted sexually. It can be contracted congenitally from an infected mother. Fetuses infected with syphilis are usually stillborn or die shortly after birth. The bacterium easily penetrates intact mucosae and abraded skin. Within a few hours of exposure, an asymptomatic body-wide infection is in progress. After an incubation period of 2 to 3 weeks, a red painless primary lesion called a chance chancre appears at the site of bacterium invasion. In males, this is typically the penis, but in females, the lesion often goes undetected with the vagina or on the cervix. The chance ulcerates and becomes crusty. Then it heals spontaneously and disappears within a few weeks. If syphilis is untreated, its secondary signs appear several weeks later. A pink skin rash all over the body is one of the first symptoms. Fever and joint pain are common. These signs and symptoms disappear spontaneously in 3 to 12 weeks. Then the disease enters the latent period and is detectable only by blood test. The latent stage may last a person's lifetime, or bacteria may be killed by the immune system, or it may be followed by the signs of tertiary syphilis. Tertiary syphilis is characterized by gomas, destructive lesions of the central nervous system, blood vessels, bones, and skin. Penicillin is still the treatment of choice for the stages of syphilis. AIDS. AIDS is one of the most serious deadly diseases in human history. More than 20 years ago, doctors in the United States identified the first cases of AIDS in San Francisco and New York. Now there are an estimated 42 million people living with HIV or AIDS worldwide, and more than 3 million die every year from AIDS related illness. AIDS is caused by human immunodeficiency virus HIV. HIV destroys a type of defense cell in the body called CD4 helper lymphocytes. These lymphocytes are part of body immune system, the defense system that fights infectious disease. But as HIV destroys these lymphocytes, people with the virus begin to get serious infections that they normally wouldn't. That as they become immune deficient. The name of this condition is acquired immunodeficiency syndrome (AIDS). As the medical community learns more about how HIV works, they have been able to develop drugs to inhibit it, meaning they interfere with its growth. These drugs have been successful in slowing the progress of the disease, and people with the disease now live much longer, but there is still no cure for HIV and AIDS. HIV can be transmitted from an infected person to another person through blood, semen, vaginal fluids, and breast milk. The virus is spread through high-risk behavior including immoral sexual behavior, sharing needles, such a needle used to inject drugs, needles used for injecting steroids, and those used to tattooing. People who have another sexually transmitted disease such as syphilis, genital herpes, gonorrhea, or bacterial vaginosis are the greater risk for getting HIV. A woman with HIV is pregnant, her newborn baby can catch the virus from her before birth, during the birth process, or from breastfeeding. Key points about reproduction. Reproduction guarantees the transmission of one generation genetic material into the next generation. Male reproductive system consists of pair of testes, ducts, glands, and external genitalia. Each testis is divided into 250 to 300 lobules. Each lobule contains 1 to 4 tightly curled seminiferous tubules. The process of spermatogenesis takes place here in the seminiferous tubules. The prostate gland produces a secretion which is milky, slightly acidic fluid that contains citrate as nutrient source and several enzymes. Cowper glands secrete mucus and alkaline fluid into the urethra. The alkaline fluid neutralizes the acidity of the uterine and the urethra. The urine and the urethra, not uterine. The bulbourethral glands produce thick and clear mucus. Some of the mucus drains into the urethra when a man becomes sexually excited and neutralizes traces of acidic urine in the urethra. Semen is white, sticky mixture of sperm and secretion of accessory glands. Spermatogenesis is initiated in the male testes with the beginning of puberty. This comprises the entire development of the spermatogonia, former primordial germ cells, up to sperm cells. Process of spermatogenesis is controlled by hormonal secretion from hypothalamus and pituitary glands. Female reproductive system consists of a pair of ovaries, oviducts, uterus, cervix, vagina. Within the ovary are many tiny sac-like structures called ovarian follicles, each of which consists of an immature egg called an oocyte. Each month, in adult women, one of the ripening follicle ejects an oocyte from the ovary. This event is called ovulation. The process of egg formation in female is called oogenesis. The reproductive cycle in human and other primates is called menstrual cycle. In female, menstrual cycle ceases around 50 years of age and it is termed as menopause. Cyclic menstruation is an indicator of normal reproductive life of females. Most cases of females infertility are caused by problems with ovulation. Without ovulation, there are no eggs to be fertilized. Some signs that a woman is not ovulating normally include irregular or absent menstrual periods. In vitro fertilization is the most effective type of assisted reproductive technology. A miscarriage is the spontaneous loss of fetus before the 20th week of pregnancy. The most common symptoms of gonorrhea in males is urethritis, accompanied by painful urination and discharge of pus from the penis. Fetuses infected with syphilis are usually stillborn or die shortly after birth. It is caused by the human immunodeficiency virus, which destroys a CD4 helper lymphocyte. These lymphocytes are part of the body immune system.